Dr. Knott, thank you so much for sitting down to talk with us today about your book, Dangerous Medicine: What Your Doctor Doesn't Know Can Hurt You. You really are a smoking gun on many medical practices and medical myths that are out there. What compelled you to write this book?
Oh, over a period of years, I found a lot of myths that were interfering with the proper offering of medical care. And I began to research a number of those things and tried to get to the bottom of why some of these myths began. And it's a very interesting journey.
And tell me about, you really are a smoking gun here. You're calling out other doctors and other people in medical practices saying that they don't know what can help heal their patients.
Yeah, and it's not a purposeful thing. It's that the training programs leave a lot of this stuff out and adhere to pseudoscience in many cases. And that allows doctors to believe in the wrong methods of treatment and diagnoses.
So tell me about this pseudoscience.
Well, when studies really don't bear out the facts, sometimes the results of the studies are skewed or misinterpreted. One study in particular, the Women's Health Initiative study, has been an absolute disaster. It was a great study, but it's been interpreted incorrectly.
And so in this book, you set out to address these medical myths.
Yes.
Okay. And so tell me, what are some of these common medical myths that all of us out here, all of us, patients don't know about? What are some of these that you address in your book?
Oh, the biggie, one of the biggies is cholesterol causes heart disease. No,
That's
it doesn't.
not true.
No, it's not true. It's not true. It was based on some studies done many years ago, and I put it in the book and how this all got started. So we all jumped on the bandwagon, and we're thinking, oh, if we eliminate cholesterol or reduce our cholesterol, none of us will die of heart attacks. Well, that's just not true. The studies haven't borne that out, but they still sell statins to reduce your cholesterol, and they tell you not to eat eggs. And I'm saying some of the authorities in the field, don't eat eggs, there's too much cholesterol. That's nonsense. Cholesterol doesn't cause heart disease, it's other factors.
Do you feel like if other doctors had similar experiences that they would start looking at some of these typical practices differently?
Oh yes, absolutely. Listen, most doctors are good people, and they're gonna open their mind to this stuff when they see it happen in front of their eyes, like I did. But we're not taught that way, and that's the problem. It's like turning the Titanic. If they could turn the Titanic, they'd have missed that iceberg.
Right.
Well, same with medicine. It's hard to get these things turned around, but they're good people, and it'll eventually happen. It's just going to take time.
And your book will be a part of that, hopefully.
I hope so. That's why I wrote it. I wanted people to know the truth.
So, Dr. Knott, one of the themes of dangerous medicine is truly that we have to take care of ourselves when it comes to healthcare. We have
Yeah.
to take that responsibility.
You have to be proactive. You have to decide, is this doctor treating my symptoms or is he trying to get to the cause of my symptoms? And that's a big problem with a lot of doctors because they're not trained to look at the cause, they're trying to treat the symptoms.
And what if my doctor just blows me off? What if he scoffs at me for asking more questions?
Find another doctor.